Since the creation of the Geneva Health Forum in 2006 by the Geneva Hospital and Geneva University, we have regularly joined our conferences to debate and discuss about global health held alongside the World Health Assembly. We warmly thank you for your contribution, participation, and continued interest in the Geneva Health Forum. The topic brings forward reflects the priorities of our partners, the list of our partners here for today, and that is with the agenda of the World Health Assembly. This year, we would like to address three important topics for Geneva Health Forum and partners: one on migration and health, one in climate change and health. Both started last year, May 2024, with the small groups, and to continue those discussions. And those two conferences will be held tomorrow. But for the first time, and we are very proud, the Geneva Health Forum and partners would like to introduce a new topic never addressed up to now on nutrition, called Nutrition: The Road to 2030, Building on Success, Facing What Next. Good afternoon and welcome, dear panelists, facilitators, colleagues, humanitarian practitioners, global health students and professionals, ladies and gentlemen, welcome. My name is Valérie. I'm a nutritionist with more than 25 years experience in nutrition settings, mainly with Médecins Sans Frontières and the International Red Cross. I'm very pleased to be with you today and to be your master of ceremony. I imagine you have heard these bizarre accents. It's the French one. I will try my best to be clear, but what I can promise is I'm very fluent on nutrition language we are going to use today. So you can ask me, but why focusing on nutrition today? So despite years of global commitments, malnutrition remains one of the most pressing and complex global health challenges. From undernutrition to obesity, what we call all forms of malnutrition, its impact spans all age groups and all regions in the world. 2025 marks key milestone for international nutrition targets, and its progress remains slow and uneven. That's why Geneva Health Forum and partners felt that it was urgent and timely to open the discussion here in Geneva, to take stock of what has worked, to understand what the gaps are, to reflect together on what Geneva Global Health Community can contribute to what's come next. Back in 2012, the World Health Assembly adopted a comprehensive plan on maternal, infant, and young children nutrition, setting 6 targets to reach by 2025. Reduce stunting in children under 5 by 40%, halve anaemia in of reproductive age, cut low birth weight by 30%, prevent any rise of childhood overweight, with exclusive breastfeeding rate for the 6 first months of life to at least 50%, and reduce and maintain breasting in children under 5 to below 5%. Also, significant progress have been made, and some countries have shown impressive results. These targets remain very ambitious. Today, 45 million children are still suffering from wasting, and I can remember that 80 days ago, the Self-Employed Food Program explains that they are expected to have 70,000 children and 17,000 suffering of acute malnutrition in Gaza. 148 million children are stunted. The consequences are devastating. Malnutrition is linked to 45% of deaths in children under 5. I'm sure Lina Show will tell more about the targets and the global situation during our panel discussion. Earlier this year, in March 2025, the Nutrition for Growth Summit was held in Paris. 47 countries took more than 400 commitments, and donors pledged significant funding for the next 4 years. We will know about this with our colleague Afshan Khan in just a few seconds. And to finish, during the Geneva Nutrition Dialogues, the meeting held here in December, something I believe home, the strategic role of Geneva in advancing global advocacy in nutrition emerged. So by session here today, the aim is to further encourage Geneva as a driver force in promoting global nutrition solution and to help build the long-term momentum to meet the 2030 targets. We will start with the agenda we would like to propose you today. The agenda is divided in 4 main movements. First, we are going to hear about Afshan Khan, Global Coordinator of the Standing Up Nutrition Movement, Scaling Up, Nutrition Movement, in a conversation with Pratit Singh. She will share the outcome of the recent Nutrition for Growth Summit and her vision and the vision of the summit regarding the Geneva initiative. After that, David, the director of 4SD, will take the lead of a high-level discussion entitled Voice from the Field, Building on Success, Facing What's Next. Then we will hear about Francisco Blanca, currently professor at the Geneva University, on this famous Geneva Nutrition initiative, and we find a few comments and testimony from the floor. And finally, the Geneva Health Forum invites us for coffee and a networking to continue the discussions. But let's start with the keynotes, and I would like to invite Pratit Singh here on the stage to open the first session entitled Setting the Scene from the Nutrition for Growth to 2030, Commitments Made, Challenging Phase, and the Road Ahead. Please come. So, Pratit, you can see Pratit. Pratit is a passionate young advocate for child and youth rights. Over the past 4 years, he has worked with United Nations agencies and international NGOs in issues including climate change, multilateralism, violence prevention, children protection, meaningful youth participation, and justice. He is currently the project coordinator for the Geneva Policy Outlook at the Geneva Graduate Institute, an initiative supported by the Republic and States of Geneva and the City of Geneva. He is also completing his master's degree in international development at the Geneva Graduate Institute. Pratit, the floor is yours. Please go ahead.
Thank you. Thank you so much, Valerie. And thank you for that generous introduction. It's a pleasure to be here this afternoon. Good afternoon to everyone. Today at this forum, I have the pleasure and the honor of welcoming a very special guest to engage in a conversation with me on a lot of different things that Valerie touched upon in the introduction. Through the opening dialogue, it is my pleasure to welcome and call on stage Ms. Afshan Khan. Afshan Khan serves as the United Nations Assistant Secretary General and coordinator of the Scaling Up Nutrition movement, leading the UN's Global Nutrition Agenda. With over 3 decades of experience in international public service, Ms. Khan has consistently advocated nutrition-focused policies and programs across development and humanitarian contexts. She has supported national governments in implementing evidence-based nutrition strategies from infant and young children and young child feeding to combating acute malnutrition in crisis settings. Her leadership has brought together governments, civil society, and the private sector to drive investments in nutrition and strengthen systems for long-term impact. Ms. Khan's expertise reflects a long-term commitment to improving global nutrition outcomes. Afshan, may I please call you on stage? Thank you so much, Afshan, for joining us today. May I kick off this conversation by recollecting that we just had the Nutrition for Growth Summit in Paris in March, and the Sun movement was a key driver summit. And of course, you were there as one of the lead figures coordinating the summit. For those in the room who might not be aware of it or familiar with it, could you start by telling us what was at stake at the summit? What kind of commitments emerged from it? And we understand that it brought together governments, civil society, and the private sector. What were the expectations going in, and did they deliver?
Thank you very much for the opportunity to join you, and thank you for making this conversation possible. I think N4G was really a seminal moment. If I look at the work that the Sun movement did alongside the government of France and Côte d'Ivoire as the chair of the International Advisory Group, and many of the UN agencies who had helped lead the substantive work and the technical discussions for N4G, we saw it was both an opportunity to highlight how nutrition impacted many other sectors. And I think when Valerie did the introduction, she was so clear that malnutrition still causes half of the world's deaths in children. And sometimes that's not well understood or well known. But malnutrition also impacts a whole lot of other things: human capital development, longer term, workforce productivity, the ability of countries to actually invest long-term in their economies. But I think N4G, its success was built around the fact that we had very strong civil society participation, a whole village of solutions that was supported by the European Commission, a day dedicated to best experiences from civil society partners organized by Action contre la Faim. The Sun movement was there strongly, both with civil society agencies that are part of the movement, many entities, but I would note exceptionally the work of World Vision and the Nutrition Dialogues, bringing together youth to speak eloquently about what they felt now vis-a-vis the current situation they're facing in the context of the intersection between nutrition, health, climate changes, and conflict, and how that was impacting their lives now, but their futures and that of their families. And then there was a full day dedicated to working with the private sector. And again, here, partners from the Access to Nutrition Initiative and GAIN, along with the Paris Peace Forum, really organized together the potential to look at the role of small and medium enterprises, as well as larger national businesses, in influencing nutrition outcomes in countries. And that's partly because we know in order to transform what people eat so that we're able to address all forms of malnutrition, both undernutrition, with the right kinds of quality, nutritious foods available at an affordable price, as well as having foods that are low in trans fat or sugars, are a really important component of being able to make sure that how we influence what people eat has to be influenced by what companies are putting out there on the market. And in that sense, I think Nutrition for Growth both created a comprehensive picture of what are some of the key levers for change, whether it was the Civil Society Forum, whether it was the Village of Solutions that looked at innovations that were being made around nutrition, on the collection of data, on the collection of information, on the ability to deliver using drones or other technologies to hard-to-reach last-mile areas. There were solutions that were put forward on the table that allowed us to leapfrog some of the challenges that are currently faced by nutrition partners. And then I would also say that I think the other opportunity that Nutrition for Growth provided, and we mustn't forget how key this is to put a political focus on nutrition. Far too often it's seen as a niche area in either health, and often due to the very good, solid work that has been done by health advocates, whether it's on the importance of breastfeeding or infant foods and the quality of those infant foods. But we also need to see a strong connect to the public policies that are formulated, and it's whether those policies are around financing, whether it's around public procurement, whether that's for schools or healthcare centers or hospitals. And we have to see changes also in the regulatory frameworks of how foods are imported, what foods are taxed, and what foods are produced in country. And the agricultural component of that becomes increasingly important, both due to climate change and, as many of the speakers have highlighted in the last couple of sessions we've had, side sessions, is really to focus on looking at agricultural productivity, giving the right mix of both cash crops and availability of food for the farmers and those that are producing the food. So in a sense, the Nutrition for Growth Summit helped connect the golden thread of the importance of nutrition for long-term growth and development of children, for health of women, and in particular, but also communities, and also the economic imperative that nutrition brings to building human capital. I would also say Nutrition for Growth was a tremendous success because you asked the question. Initially, I think in the current donor environment, there was a real risk that it would fall far short of commitments compared to some of the previous summits, whether London or Tokyo. What we saw with the current Nutrition for Growth Summit was there was $27 billion pledged in commitments. The big shift, I would say, from Tokyo was those commitments were not largely, but I would say significant shifts in that they came also from international financial institutions. The African Development Bank, the World Bank were big commitment makers. So was the European Commission, and the European Commission, I think, has been instrumental in some of the financing for nutrition, and we hope that will continue. But Paris was landmark in terms of countries, philanthropies, and institutions all stepped up to make significant commitments. And those domestic budget announcements that were made and mobilized by several sun countries, we want to make sure that those commitments to action, both in terms of clear national plans that were presented, but also in terms of domestic budget commitments, can now be leveraged to obtain additional financing, whether that's complementary financing from philanthropies, international NGOs, or from the IFIs. We see a real opportunity to emphasize and stress more that an investment in nutrition has a $23 rate of return one for each dollar, as estimated by the World Bank. So here we see an opportunity to show the power of nutrition and its ability to transform societies. And you may say, well, why is this important? I mentioned the 50% child death figure, but the longer term impact also of not investing in children, in particular those first 1,000 days, are lower capacity in learning, a lack of cognitive growth and development. The impact on women can be 1 in 3 women in the world now suffers from anemia, can be shortage and difficulties in their own health, but the health of their children when they're pregnant, and longer term, their impact on productivity. And I would also say, perhaps to end, that in a way, what we got at the Nutrition for Growth Summit was a stronger compact and integration of nutrition across sectors. I think both the UN agencies that helped organize some of the substantive sessions and the French government really brought about a strong understanding about how important it is to integrate nutrition in different sectors, whether that's health, whether that's social policy, whether it's agriculture, or whether it's water and sanitation. And I think the other piece, I think, came out quite strongly, and I was very happy to see the voice of Sun countries there, is the emphasis also on longer term, what needs to be done around prevention. Because prevention of malnutrition, and that's malnutrition in all its forms, whether it's stunting or overweight and obesity, is going to be able to save resources longer term from government budgets, whether it's responding to crisis or whether it's the health budgets. So in overall fact, I think Nutrition for Growth raised the bar on how we see nutrition influencing longer term development outcomes. But there's a lot to be done, and many of the partners in the room here will be so important to that, to make sure those pledges and commitments turn into action on the ground at the country level. So we're able to see the impact we want to see, including with the nutrition targets, on tackling all forms of malnutrition, on improving the rates of stunting, wasting, overweight, and obesity, making sure all of those targets are met and reduced, and also to really make sure that we see continued support to countries to move the agenda forward.
Thank you so much, Afshan, for that really comprehensive overview over what came out of the Nutrition for Growth Summit. And I think that it's a milestone in itself in terms of marking commitments, bringing the private sector, connecting the international framework to local action, to driving countries. I'm also at the same time cognizant of the fact that the summit came at a very challenging time in itself, at a time where there's massive rise in conflicts, polarization, to a time where there's a massive cut in international development assistance. And so just from that, and since you were also mentioning a host of commitments, are there also any challenges that you see coming up, the challenges in implementation of the commitments over the next few years? And are there any particular bottlenecks, say financial, political, or otherwise, that you think deserve more attention for the next few years?
Thank you. I think in the current environment, this is a really important question. Last Friday, there was a report launched on what the impact of some of the funding cuts is going to have on malnutrition, and particularly in humanitarian contexts, and the impact of that food crisis that we're seeing in several countries connected to both conflict and climate. The cuts that have been made in budgets, and often the US is cited as one example, but I think we're facing an overall challenge around development assistance as a whole. And nutrition is also clearly impacted by that. Valerie raised the situation in Gaza, but the situation in Gaza is perhaps one of the most visible and stark, because it's clearly a man-made crisis, as is Sudan, as is Yemen. But if we look at the intersection of conflict and climate and the budget cuts now, we're likely to see far less investment in nutrition. And the impact of that goes beyond statistics and figures. We know that, for example, we've been monitoring with other partners immediate impact of some of the budget cuts. And those budget cuts, yes, they affect some of the development partners, but they've also cut the available investments that governments have in countries. So, for example, in Kenya, more than 600,000 people living in areas plagued by drought and acute malnutrition will lose access to life-saving food and nutrition support. Services in Sudan are going to be cut. The Standing Together for Nutrition Consortia estimates that aid cuts of around 44% are threatening really decades of progress that have been made in nutrition. And 2.3 million children could lose access to life-saving treatment, and up to 60% of these children may not survive without interventions. So the long-term projections on death as a result of some of these cuts are stark. So in a way, we have a real challenge, and it brings it back a little bit to this nutrition integration, to look at how can we help bundle and deliver services in a far more efficient way. I see Claudia Hudspeth in the room. We've been working with Gavi, Aga Khan Foundation, and Sun to see what can we do to make sure some of the immunization services are bundled in a better way, so that when a child is vaccinated, that same child is screened and treated if needed for malnutrition. So the bundling of services and some of the efficiency gains that can happen as a result of those interventions is key. Earlier, I spoke about the integration of nutrition across different sectors. When we look at water and sanitation, it's another area. I just came back from Côte d'Ivoire. I was on Sunday. There, they've set up a system called the franc, like the coin, like the money, sorry. But here, we see also there's an opportunity if we integrate better water and sanitation, social protection, nutrition counseling, breastfeeding counseling in an integrated way, we'll be able to see better outcomes for nutrition. So the more government can work towards an integrated multi-sectoral plan with investments in health, in food security, in social protection, in water and sanitation, and education, the better we'll see nutritional outcomes in a more efficient way and at a lower cost.
Thank you for that overview. From what it seems to me, a lot of integration, a lot of coming together is required, which brings me to my next question, is that we're having this conversation in International Geneva, which is really a hub of multilateral action, be it in health, humanitarian affairs, or human rights. In your view, what is the role that International Geneva could or should play in advancing global nutrition agenda? And also to put forward a little bit of my due interest, which is how can we better connect the global policy infrastructure to the needs and voices of young people who are not only beneficiaries, but also key stakeholders in this process of more equitable and sustainable, not only food systems, but also the nutrition agenda. How do you see this connecting?
Thanks so much. I want to recognize some of the colleagues that are here that have very much helped with coming together around Geneva and the nutrition dialogues. I do think there's a real opportunity with Geneva as a hub for health, for some of the innovation that we're seeing. We're here on the health campus. I also spoke already about Gavi, but I also want to highlight the trade piece, because increasingly that's becoming very, very important. And Geneva is also the center, and you're a clear example of that, of many young people coming together. And I think when I look at innovation, transformation, change, youth voices, energies, and ideas are essential in that fight against malnutrition. At Sun, we've had a number of partners who've worked on youth-led advocacy, transforming communities and driving policy change. We've seen this in Zimbabwe with the Zimbabwe Civil Society Organization for Scaling Up Nutrition Alliance. They launched a youth-led advocacy campaign on adolescent nutrition. The campaign engaged school-going adolescents in promoting healthy eating, physical activity, and contributed to national school nutrition guidelines. At N4G, we saw the 4SD group work with French schools to bring them into the engagement around the N4G summit. So I think really here we see Geneva as a hub for several international activities, but there's also an opportunity to engage far more effectively with young people on ideas for innovation. And I'm glad we're here at the Biotech Hub, because here again, I do think there's an opportunity, and the NGO community and presence has been so strong as well. I see Christine Campo here from CARE. And here again, I think there's an opportunity to say, how do we bring NGOs with their vast networks of competence to work together in a way that allows us to work alongside young people, civil society, the best that the UN system and government technology and innovation has to offer to really create a transformational landscape for changing the face of malnutrition. Thank you.
Thank you, Afshan. That's a very, very encouraging agenda, and particularly for a fertile ground like Geneva, which is really about bringing people together and taking forward young people, stakeholders, civil societies, and NGOs together. I would maybe turn to the floor to take maybe 1 or 2 questions, if there are, for Afshan, and then we can move forward. Yeah, I see you had there. I see a hand there.
Thank you very much. Thank you for this great update on the nutrition for growth. And I think one of, my name is Fatia Terki. I work for the Committee of Food Security in Rome. I think one aspect that was mentioned is the importance also to focus on what's going on in emergencies and nutrition in emergencies and protracted crises. The Committee of Food Security is a body that is hosted by FAO. I see some colleagues from FAO here. We are made of 130 member states, civil society, private sector, and also foundations. And we do produce and publish a number of policy and guidelines that we hope that will be uptaken by the countries. And when you say why Geneva, I think there is one aspect that we don't talk a lot about is the right to food and to nutrition. And I think this is also an opportunity to highlight these issues in terms of improving and guaranteeing access to food and nutrition to everyone, leaving no one behind. Thank you.
Thank you for that.
Thank you so much for also raising the right to food. You're absolutely right. I think Geneva, both as a humanitarian and human rights hub, brings a huge opportunity to continue to advocate strongly for those rights, and particularly as we're seeing more and more in humanitarian contexts, that right consistently being violated. So thank you for raising it, Fatima.
Thank you so much. And looking at the time, I think this is the time that we move on from the opening dialogue and delve into the panels at hand. But before that, thank you so much, Afshan, for that really insightful opening and a very encouraging start to what is going to be exciting Geneva Health Forum.
Thank you.
And thank you so much. I pass on to you, Valerie.
Thank you. Thank you very much, Afshan, Rachid, for this very insightful discussion. Take care. Wow. So let's move to the round table now. For people who had questions, we can maybe keep them for the debate after the round table. For this session, I'm really pleased to welcome on the stage Dr. David Nabarro. The panel discussion will be entitled Voice from the Field, Building on Success, Facing What Next. David is a strategic director of the Geneva-based 4SD Foundation, which is co-founded to support multi-stakeholders action in food system, nutrition, and public health. He's a widely respected global leader in both nutrition and sustainable development. He's also served as chair of the Global Health and co-director of the Institute of Global Health Innovation at Imperial College, London. Dr. Nabarro has played a key role in the global nutrition efforts from the UN Food Summit System Food System Summit to preparation to the recent Nutrition for Growth Summit. In long-standing leadership in the UN system, PAN's nutrition, food security, and pandemic response, a truly remarkable career dedicated to advance global health and nutrition. David, the floor is yours with your panel. Thank you.
So Valerie needs a very special clap as well, because if it wasn't for her, we wouldn't be here. And you can feel the energy, that's laughter and smiles. And I'm delighted that the room is almost full. And I'll tell you why I'm delighted. This is a busy, busy week. And there are lots of people saying, come to our session, come to our session. But no, you've all come to Campus Biotech and you come to focus on nutrition. So important. Thank you. Now, we've got a great panel and we're going to really be presenting voices from many different perspectives. And I'm going to quickly invite all the panelists to come up and join us here. I'll say them by name. And as they come up, I'll say a quick word or two about them. The introductions won't be as long as Valerie's introduction of me, but that's because I want there to be more time for you to hear them. They're all amazingly, amazingly brilliant people. Can I invite Assistant Secretary Azucena Milana Dayangirang from Philippines to come up and sit at that end of the stage. Brilliant. Thank you very much indeed. Azucena and I were together with others at Nutrition for Growth. It was absolutely brilliant. Please take a seat, because I do want to just say a couple of things about you. I mean, Azucena is a public health leader. She's been working in this space for over 20 years. Her particular focus has been maternal and child health and nutrition in the Philippines. She's been working at local and national level, and in particular has been focused on a fresh milk supplemental feeding program in a town called Davao, which is right in the south of the Philippines. It's some way away from Manila, but then she had to move to the center, and she's really been championing women and children in a beautiful way. Thank you for joining us. And let's now invite Mumuni Kinda. Mumuni is General Director of the Alliance for International Medical Action. That's an acronym that's said quickly is ALIMA. I met them actually working in West Africa in 2014 and 2015, a really lively and brilliant organization. And to Mumuni, merci beaucoup pour venir ici parmi nous. Vous avez dit que vous parlez en anglais, mais je voudrais vous donner la bienvenue en français. Excusez-moi pour ma mauvaise française. Thank you for joining us. And we've already heard reference to Dr. Claudia Hudspeth, who's the Global Health Lead from the Aga Khan Foundation. Dr. Hudspeth is Canadian. She's medical and public health expert, but she joined the Aga Khan Foundation in 2017 from a career that had her in McKinsey, in the UK government, in UNICEF, and in WHO. She's really been around and done an awful lot of important work on health system strengthening with a focus on community primary care, as addressing undernutrition and tackling the social determinants of poor health. Nancy Alberto. Nancy's joined us from FAO in Rome, the Food and Agriculture Organization. She brings over 20 years of global experience in nutrition, humanitarian programming, and development policy into important aspects that go right across. And we're going to run out. We've got enough chairs. Good, fine. Oh, and she's done large-scale programming. She's done policy, and she's really helped WHO, WFP, and the FAO bring nutrition into their work. Thank you, Nancy, for being with us. And now, Lena Mahi. Lena Mahi is cross-cutting lead for partnerships for healthy, safe, and sustainable diets, nutrition, and food safety at the World Health Organization. And we're particularly pleased that Lena is here, worked with her for years on many different issues, and she is just an extraordinary leader who really is able to facilitate partnerships, advocacy, and communications around WHO's nutrition and food safety strategies. So here's our panel. And the way we're going to do it is we're going to talk about experiences in communities. We're going to talk about lessons that have been learnt, and we're going to share. Each panelist is going to have 5 minutes to make some opening remarks, and I will tell them when their 5 minutes are up. Then I'll invite some conversation between the panelists. Then I'm going to invite all of you to join in. So if you've got ideas brewing up, please don't lose them. Keep them right at the top of your head, and then get ready when we open up, and we'll try to have a rapid fire conversation. And then I'll invite the panelists to make some reactions at the end. And then I'm going to invite Dan Irvin of World Vision, who's already been referred to give his reactions from his position as global head on nutrition and health at World Vision. Dan, thanks for joining us. Dan has just come back from the Philippines. There's a little connection here because his family is half Filipino. Isn't that right, Azucena? Yeah, brilliant. So that's us all together. Here we are for you. I want to invite you to come into our world, and we'll come into yours. And let's hear, first of all, from Azucena talking about Philippines, and that's working. You have the floor, ma'am.
Thank you very much, David. And I'm really very fortunate enough to be here in Geneva to help to share the country's experiences on malnutrition, as well as the ways forward and the actions that we've taken as far as malnutrition problem is concerned. Actually, I am representing my country, the Philippines. My Secretary of Health was just appointed or elected as the president of the World Health Association.
Well done.
Yeah, Assembly,
well.
the 78 here, and I'm fortunate enough to be one of the delegates here in the Philippines. Well, actually, sharing with you the Philippines experience is worthwhile. Well, I traveled around from Manila down here to Geneva for 17 hours. Is not really a good, experience, but before here with you all, I would like to share what the Philippines has been doing. Well, the Philippines has faced difficult, challenges, especially on malnutrition. We call the triple burden of malnutrition. We have undernutrition, overnutrition, as well as micronutrient deficiencies disorder. Amongst the three, we have actually the wasting of undernutrition. We are on track of that, but the rest, we really have to, go and triple our efforts to be a contributor to the World Health, to the Sustainable Development Goals by 2030. So despite these challenges we had, I'm very fortunate we have a multi-sectoral platform, particularly amongst our ABCD networks coming from the Sun. So what is A for the academe, B for the business network, C for the civil society, D for the donors / UN agencies, and Y is the youth. So this is a very good example of a multi-sectoral collaboration, the field wherein our networks are been replicated from the national down to the sub-national level, even at the local government units. So what is unique with the Philippines is we have 7,000 islands, and this is composed of, we have geographically isolated and depressed areas where malnutrition is highest. So in fact, one of the most vulnerable populations that we have are women and children, and in particular, young children. So with this, we are very fortunate that in 2024, we just had a meeting at the palace with the president himself, and we presented the challenges that we have with malnutrition in the country, having less investment from the national level down to the local government unit, and that is the reason why that the president, in fact, ordered in what we call, there is a presidential directive to focus on the first 1,000 days.
Yeah.
And and then make investment by 2026. And calling all the multi-sector platform, the UN agencies, as well as other funding agencies to really join efforts with government. So that's how we are very fortunate enough. Then we have a problem. We have also what we call the Philippine Plan of Action for Nutrition. This is a national costed plan of action from 2023 to 2028. And we have actually embedded in the Philippine Plan of Action for Nutrition what we call the 3 pillars. The 3 pillars on healthier diet. First pillar, the second pillar is on cultivating behavior, social change behaviors, and then having it a better practice for all citizenry of the country. And the third one is on governance. So what we are also having in the Philippines is we are fortunate that local government units, the lowest level of society in the country, are really pushing for nutrition. Even during the COVID-19 pandemic, we prevented the surge of stunting and wasting, and of course micronutrient deficiencies, because local government units with the mandate of really having to ensuring food security in the country, establish task forces to deliver food, nutrient-rich food, particularly daily, because there were lockdowns during the COVID-19 pandemic, so access to available food is really there. So that's one thing that the Bayanihan system of what Filipinos are famous for. And we also have the policies. My agency is in charge of the policy base, being the highest policy-making body on nutrition in the country. We develop policies. We have the sugar-sweetened beverage taxation. This is the reason why that we have lowered our intake of sugar-sweetened beverages, especially among teenagers and children. And also, because we have actually in 2023, we had a survey on increasing overweight and obesity, especially among adult population. So we are the front runner of WHO, being the front runner, Francesco is here, front runner of the Stop Obesity movement of the World Health Organization. And we are actually on the final stage of finalizing and approving our nutrient profile model, as well as later on, we will come up with a front-of-pack labeling. So, and another good thing is that we are doing right now is we are in the process of finalizing the resolution. This is alignment with the World Health Assembly resolution on wheat flour fortification. There's the inclusion of folic acid and iron in wheat flour. So all these we are doing because we want to ensure that we are contributors to the Sustainable Development Goals by 2030. And hopefully with the help of the civil society alliances and other sun networks, we will be, proud to say that we contribute a lot for this one. And wasting, we are on track.
We are
Thanks so
proud
much.
to have you here.
So much.
Thank you. I was saying to Azucena Milana Dayangarang that when I heard her speak with a young nutrition champion from Philippines and others at Nutrition for Growth, I really felt massively inspired. I feel the same today now. It's not just that she and colleagues went to see the President Bongbong Marcos, and enabled him to decide he wants to prioritize nutrition. It's also that this is a truly multi-sectoral approach with full participation of local government, full participation of schools and universities, full participation of the whole of society, and really focusing on women and children who are vulnerable. Thank you again for your witness, and we'll come back to you very shortly. Now would be the time when we go to Mumuni Kinda, General Director for Alima. And Mumuni is going to give us a little bit of a deeper insight into Alima's work, particularly with the very severely malnourished. Mumuni, you have the floor.
Thank you.
And it will work, but that one's better.
Thank you very much, David.
Thank you.
What I can say is that as a medical doctor, I've been treating malnourished kids for more than 20 years. And just last year, Alima teams treated 350,000 malnourished children in about 13 countries in West and Central Africa. And our experience with malnutrition is very simple. As I can say that when there is ready-to-use therapeutic food, we can save lives. So this is a basic, this is basic for us. And globally, we have gone from treating 0 children 55 years ago to nearly 9 million children in 2023. Yeah. And this is a real progress, mainly due to the outpatient and inpatient strategy and ready-to-use therapeutic foods. But here is a scandal for us, as 20 million kids suffer from the severest form of malnutrition, and we barely reach half of them. And why? Why? Because there is a ready-to-use therapeutic food crisis unfolding for years. And as you know, we all know that malnutrition is a public health emergency. And yet there is no predictable financing at the scale of the needs as we have for other major health challenges like vaccines, HIV, AIDS, malaria, etc. And malnutrition is the #1 threat to child survival. So this leads to shortage of what the WHO classifies as an essential medicine across our health centers. And in the worst case, we are forced to send severely malnourished children home without nothing in some of our countries. And to take an example, I can say that I'm alerted by the teams, our teams in more than 13 countries about imminent shortages every week. And some countries are particularly affected, such as Niger, Chad, and Nigeria. And now the violent shutdown of USAID and funding cuts in the UK and Europe are worsening an already critical situation. But we have hope. And what gives us hope is we know that one way to get the financing for ready-to-use therapeutic food and other specialized foods at the scale of the need in a sustainable way. How to do that? For Alima, we think that we can tax sugary drinks, you know, as we know that a soda tax can raising the price of a can by just 1 cent in France would yield about 82 million euros. And that is enough for us to treat 2 million children, approximately. So imagine if we have 10 countries about this kind of initiative. So we start approaching with 10 countries about $1.4 billion needed annually. You know, and such a system of taxing air travel worked for HIV and AIDS, and it can work in this fight against malnutrition. Yeah, because for us, no child should die from malnutrition. We have some examples of what is working with our teams. And I don't know if, David, you want me to talk about that?
I give you about half a minute. Yes, please.
Okay. Okay. So, what is working? I can take three examples, of initiatives that are working in the ground. So I can take the example of the MUAC mother. So the screening by the measurement of the middle upper arm circumference of kids. So this initiative places mothers at the center of the screening strategy and recognizes that they are best placed to detect early signs of malnutrition in their children. And we think this is something to scale up around the world. And the simplified protocols. Simplified protocols like Optima, we call it Optima. It's optimizing the treatment of malnutrition, and Compass is another initiative for another NGO. And this initiative that treat MAM and SAM with reduced dose of ready-to-use therapeutic food have shown to be as effective and cost-effective in randomized clinical trials. And we have treated more than 200,000 kids now in districts that have scaled up the approach in Niger, Mali, and Chad and Nigeria. So we are seeing increased coverage, decreased some incidents, and a much more efficient use of ready-to-use therapeutic food. We reach 3 kids per carton compared to the current 1 carton per child under the current SAM-only approach. And the last initiative is combining several strategies. And combining interventions, especially preventive actions in the first 1,000 days, will be important for us for Alima.
Thank you.
And for example, we are testing in several contexts whether SQLNS incentives vaccine uptake in areas with high malnutrition and low vaccination coverage. And so you can get a double impact from one intervention: less malnutrition and less vaccine preventable disease like measles. So we have some difficulties, and the old protocols are unsuitable and far too vertical for us, for Alima. And an example of the inadequate integration of nutrition into healthcare is 2 different channels for acute and chronic care, resource mobilization, and ready-to-use therapeutic shortage. There is an urgent need to make ready-to-use therapeutic available in sufficient quantities and on a long-term basis for Alima. So this is what I want to share.
So that was absolutely superb. I'd like to give a big warm hand. And we've asked Mumuni Kinder to describe this work in 5 minutes without using slides. I know he would have liked to have shown us this incredible data set. Thank you again for your leadership, and in particular for describing the Compass approach, where you found ways to get the same results but reducing the amount of expensive ready-to-use therapeutic food that you used. Thank you again for your incredible leadership and hard work. And now to another real practitioner, Dr. Claudia Hudspeth from Aga Khan Foundation. Claudia, you've got time now, 5 minutes.
Thanks so much, David, and thanks to the other panelists as well. It's a pleasure to be here. So the Aga Khan Development Network, for us, nutrition is a real top priority. At Nutrition for Growth, we made a pledge of 45 million over the next 5 years to really support integration of nutrition into health systems, and food access and availability, including access to affordable foods. A lot of the work that we do obviously expands different geographies. We work in the highest plateaus of the Himalayas and the Karakoram and Pamir Mountains, down to the mangroves of the Swahili coast. And so we can't really take a one size fits all, but there are some threads of things that I'd just like to highlight that I think are really important in how we do our work. I think Afshan spoke about the bundling of services, and we think about it as taking a systems approach. So we integrate nutrition into health systems, into food security and agricultural programming, into early childhood development platforms, into schools where we can, into water and sanitation systems and social protection systems. So I'm just going to give you one example. The Central Asia Stunting Reduction Initiative that we launched a few years ago with internal resources pledged by His Highness for a single generation of funding. And I think a single generation of funding is actually a really rare opportunity for us to be able to break the intergenerational cycle of undernutrition. And a lot of the short-term funding that we see we're not able to make the progress we need to against some of the indicators that are very slow to move. But the Central Asia Stunting Reduction really looks at integration into health systems. So thinking about, delaying age at first birth and birth spacing, really tackling issues of maternal nutrition, ensuring women, uptake delivery services in health facilities, and that those babies that are born in those health facilities are weighed at birth. It's a very simple intervention, but many babies aren't weighed at birth, and we miss a lot of those low birth weight and small for gestational age babies, and we're not able to give them the best start in life as a result. We also are looking at the program itself actually really focuses on not waiting for a child to become stunted or wasted, where they're clinically apparent, but actually identifying growth faltering and catching children before they lose weight or before they lose stature, and to try to get them on the right road to recovery as a form of kind of improving their growth trajectory, but also improving our chances of success. In addition, there was a reference by Afshan also on the integrated nutrition and immunization programming that we do. We hardly think about immunization these days in AKDN without thinking about nutrition programming that goes alongside it. We know that children who are undernourished are more likely to suffer more severe episodes and longer duration of disease. And we also know that many children who are under-immunized are also likely to be malnourished because of a complex series of, vulnerabilities and lack of access to services. So integrating immunization and nutrition makes perfect sense for us, and we're trying to do more of that and to really scale our impact, not just for impact in terms of the outcomes for children, but impact in terms of cost efficiencies, especially important in today's environment. We also look at integrating nutrition into early childhood development programming. With the nurturing care framework, one of the key pillars is nutrition and health, and that's absolutely critical for us. So we work with parents. And I think one of the important things that I'd like to flag is the work that we're doing around food and agricultural systems and climate resiliency and nutrition. I think people talk about food and agricultural systems, but I just want to give some really tangible examples of how we do that integration. So we have an initiative called the Indian Ocean Coastal Regeneration Initiative. It's really looking at rebuilding livelihoods and ecosystems across 6 countries that touch the Indian Ocean, which includes regeneration of 150,000 hectares of mangrove. And while this is a climate initiative initially, we also are integrating nutrition through things like blue foods, aquaculture, nutrition champions, looking at food supply and social and behavior change communication. Other examples of promotion of cereals in areas and more heirloom cereals and more nutritive cereals in places like India, like with millets, for example, and sorghums. We're doing work with things called pigeon towers in Syria, which gives people access to protein sources, but also manure for growing vegetables. And so this is not just purely agriculture, but with a true nutrition lens. So my very last point, David, is on data. the work that we do in nutrition, we work with the Aga Khan University as one of our sister agencies, and we're lucky to have them with us because we're able to strengthen data systems, monitor these programs very intensively, and tweak and learn from them. And we have a very strong learning agenda associated with all of these, especially integrated nutrition and immunization agenda. So I hope at the next World Health Assembly we'll be able to share some of those results. And thank you.
Thank you for sharing them today. Never let anybody say responding to malnutrition is too difficult to do in healthcare and in agriculture programs. It's doable, as you've heard. And to help us understand the link between nutrition and the food and agriculture systems on which we all depend, let's hear now from Nancy Alberto, Deputy Director of the Food and Nutrition Division at FAO. You have the floor, Nancy.
Thank you, David, and good afternoon, everyone. It is a pleasure to be here with you today, and it's really been a delight to listen to Afshan's reflections on nutrition for growth and to hear from my esteemed panelist here. I'm not exactly a voice from the field. I come from FAO working at headquarters in Rome, but I saw the title of our agenda today, Building on Success and Facing What's Next, and I wanted to talk about the opportunity for enabling healthy diets through further embedding actions across sectors that can indeed lead to achieving healthy diets. This Afshan referred to already in terms of talking about nutrition integration. And it's not a new concept. Thinking about healthy diets is not a new concept. Thinking about systems is not necessarily a new concept. Over the last several years, we've been talking a lot about systems. But recent data and evidence, I really think, gives us new opportunities for moving further from just the talking and really embedding in systems at a scaled way. And we just heard Claudia give some excellent examples of some of the work that she's doing on that embedding nutrition, integrating nutrition. But talking about the data and evidence that's helping us move further in this agenda, I'm going to start with a statistic that's not very pretty. It's 2.8 billion people across the world cannot afford a healthy diet. But having that piece of information that we have been measuring now for about 5 years has also led us to think about what are the solutions. And there have been a number of different compilations of evidence of solutions to bring that number down so that fewer people are unable to access a healthy diet for economic reasons. For example, in 2022, the State of Food Security and Nutrition in the World report, or the SOFI report, documented that worldwide support for food and agriculture was almost $630 billion a year. Almost $630 billion a year. Now, if we combine that knowledge for what kind of money is already going towards the food and agricultural sector with the true cost accounting of food that's recently been published in the State of Food and Agriculture reports coming out of FAO, that document that unhealthy dietary patterns account for roughly 70% of the more than $10 trillion hidden cost of unhealthy diets. It tells us that we can repurpose that $630 billion a year to something that can help us reduce that $10 trillion cost burden on our health systems. And that is moving us towards solutions for repurposing agricultural investments to diverse, nutritious foods, which can absolutely be monumental. Another example, the 2024 State of Agriculture Commodity Markets. I've talked about lots of state of reports, David. I hope that that's not confusing you. It showed that there is policy space within WTO rules to further nutrition objectives. What does that mean? That means nutrition and trade are not at odds with one another. There are available policy options within World Trade Organization rules to benefit healthy diets through trade policy. We can do this with excise taxes. We can do it with nutrition labeling. There are a number of different options. So now we have got tools of what we can do in the agriculture and food system space to enable healthy diets. But it's not just the agriculture and food system space. And again, Claudia already mentioned another space that's extremely important, and that's the climate space. And our recent evidence and data that's being generated over the past several years that shows the value of healthy diets towards those sectors reaching their sectorial goals is extremely important. And we as the nutrition community need to elevate that information. For example, when it comes to climate, we know that if emission targets are met in all sectors other than agriculture and food sectors, that the ambitions of the Paris Agreement will not be met. We cannot meet the Paris agreements without action in food and agriculture. We also know that practicing healthy diets can reduce greenhouse gas emissions by as much as 13% in the food and agricultural sector. Now, we know we have to be acting in the food and agriculture sector. And what can we do to reduce greenhouse gas emissions? We can enable healthy diets. That means enabling healthy diets is a solution for the climate sector. It's not just for us, it's for the climate sector. When it comes to the biodiversity sector, it's the same thing. If we shift to healthy diets, we can protect forest, we can protect land, we can protect water, and all of this is the goal of the Convention of Biological Diversity. This means enabling healthy diets is not just a solution for the nutrition community, it's a solution for the environment community as well. And I have other examples, but I know my time is short, so I'm going to leave it just to say that we have more evidence now than we did when the decade of action on nutrition started 10 years ago. And now we've got that decade extended, and we need to use this evidence and use that political platform to scale these actions across systems.
Thank you very much, Nancy. There's one kind of quite important statistic in there that most of the adverse impacts of food systems, the kind of invisible costs, actually relate to people eating the wrong stuff. And I was very, very pleased, Nancy, that you brought that up so strongly. And that takes us now to Lena Mahi. Lena's, I noticed there was an H drop there. Lena Mahi is come from WHO. And what's really exciting is that she's now going to wrap up the discussion from the WHO perspective and look at the way in which Decade of Action goals have actually been fulfilled or not. Over to you, Lena.
Thank you very much, David. And I'm really happy to be the last speaker because so much has already been said, so I can be shorter than the others, I guess. But first of all, I'm very happy that for the Geneva Health Forum that nutrition is now on the agenda and this topic is there. Thank you very much for that. Because I think we are at the crossroads of like for nutrition, where we have progress, but we also have setbacks, but we also have renewed commitment, and that's an opportunity. Sorry. So let me first talk a little bit, although it has already been done, about the setbacks. We have a challenging environment. We have climate change. We have protracted crisis, economic instability, COVID-19 pandemic that has pushed people into poverty. And the figures have already been mentioned, but also increasing inequality is something that needs to be mentioned. And to give an example, referring also what Mumuni said, there's money needed if we want to treat children for acute severe malnutrition. And that money needed is about 0.1% of ODA. But if we look at what food and food businesses, what the profit has been during the COVID pandemic, 2 years from 2020 to 2022, it's about 1 billion every 2 days that there was of profit. During that time, 62 new billionaires, food billionaires came. So we have to put that in perspective, and that's something that we need to talk about, these power imbalances and inequalities and how to address them. And WHO is also ready to talk about these elephants in the room. But for progress, also, there is growing recognition that nutrition is central to development. Afshan, you've already referred to it. We all know it. It's just that we have to do it and work together. There is acknowledgement, it was also mentioned already, that it's about the double burden of malnutrition, so that also not only in low-income countries that people are suffering from undernutrition, but people are also suffering from overweight, obesity, and diet-related NCDs, and the health systems might collapse if we don't address this in time. So nutrition is a global imperative, and looking and comparing with 30 years ago, it's amazing to see how now people talk about nutrition at the highest level, but the fight is never won, and we have to continue to put pressure. And that was also what was already said by our colleague from youth that was speaking about it. With regard to the global nutrition targets, Valerie, you've already mentioned them, so I'm not going to repeat them. Just to say that 2 of the targets we're on track, but 4 of the targets we are not. So we have to accelerate our work. And so I wanted to use the metaphor of being on a sail ship. And so it's time to set the sail. And for that, first of all, we need a compass. Where do we want to go to? And for that, we have the global nutrition targets. And this week, through the leadership of Ireland and Ethiopia, a resolution hopefully will be adopted for the global nutrition targets to be extended. It's not just a technical issue of extending the global nutrition targets. This is a moral commitment of countries that they want to do that. And I think that's very important, that it's not just technical and political commitment. So, so that's the moral compass. But we also have the ship where we can all be on sailing, and that's the decade of action of nutrition. And Nancy, you already mentioned it, that the decade is extended. This is again thanks to leadership of countries of France and Brazil that work together to have a resolution accepted in New York at the General Assembly. So now we have 5 more years to work under this big umbrella that could be our sailing ship. So we have the compass with the nutrition targets, we have the ship, now we need the wind. And I think that is the sustained funding that we need. And to close, David, because I'm really shortening, what now is important is that we have the power of us here. And I want to then link this to the Geneva Nutrition Initiative or hub that could be created. We constantly should advocate and highlight that there is money if you want. I mean, we see it now in what type of industries money is invested. Arms industry, for example. So there is money, but we need to have a constant voice. We need to have the purpose and the moral compass that we have, the global nutrition targets. We have the ship with the multi-sectoral decade of action that is focusing on food systems. It's focusing on trade and investment that was also mentioned. We have to do much more about it. Nutrition, governance, it's all there. So I think we just have to now really make a Geneva nutrition group of friends or whatever we're going to call it to constantly highlight the moral and political obligation that we have.
Thank you very much, Lena, and thank you for the whole panel. So in a way, the question before us is a simple one: how to increase the political profile of nutrition in countries across the world, and through that to stimulate greater investment in coming generations through ensuring that in early life they're well nourished. Now, I'd really like to go across the panel and invite each of the panelists just to say, if they want to, have you heard anything from the other panelists that's interested you? Have you got some ideas emerging? And then I'd like everybody in the room to be thinking, what do I want to contribute to this conversation? And we've got a bit of time, and I will invite you all quickly to offer your observations as well. Let's come first of all to Azucena. What have you heard?
Okay, so based on the discussions going on with my co-panelists, well, actually what struck me most is on integration of nutrition in the many sectors like agriculture, social protection, health in particular, and most especially in what we call convergence of actions, especially at the local government units. Well, my task as the executive director and assistant secretary of the National Nutrition Council of the country is really very challenging. Right now, I have 3 ABCs in mind. Well, A for acceleration. We want to accelerate actions for nutrition outcomes in the country. We just finished with our local elections, midterm elections. We have new set of local leaders, local government units, and we want to continue our big bang advocacy campaign for them to become nutrition champions themselves. So we want that more and more nutrition champions so that nutrition agenda will be incorporated in their development and the executive legislative agenda. So B is on budget. Budget, because there will be no success for nutrition outcomes if there are limited budgets from the local government units. In particular, I was talking to Upshan a while ago before this panel discussion earlier. I was talking to her that domestic resources available for nutrition is so limited in the country, but I'm hoping that external resources will be available soon with ADB and the World Bank with us in this quest for nutrition outcomes. And then local government units will be able to plan. We will technically support local government units to formulate their local nutrition action plans that will be costed by themselves. And technically, we will support them on that one. So, and the C is again convergence. We want to have convergence of actions on health, on agriculture, on social protection, climate change, everything, because Philippines is really an unfortunate country. We are situated in the Pacific Ring of Fire, wherein disasters almost come in all year around. No, so we are really, really very hopeful. But with everybody in action, we will particularly reduce the problem of malnutrition, and we have healthy Filipinos ahead of us. And lastly, I always believe in the saying that if not us, who? And if not now, when? So thank you very much.
Thank you very much. There is Azucena. Just imagine your president of Philippines, President Bongbong, and Azucena and team come to see you. You say, yes, it's strong stuff. Thank you very much indeed, madam. And to Mumuni, what have you heard that gives you at least some moment to reflect or even optimism?
Yeah, what I can say is about efficiency. You know, we know there is no money to continue to do as we have done for many years. So we need to use the resources we have efficiently. So I can give two recommendations. The first is to quickly adopt efficient treatment strategies, like combining some strategies like Optima or Compass, simplifies protocols, and to associate multiple activities in the health system. Yeah. And for us, for Alima, we push to adopt some new ways to mobilize new resources. This is why we suggest to tax sugary drinks. It's an example, but we can have other examples. But we think it can be a way to leverage more resources in order to continue our fight against malnutrition.
Thank you.
Yeah.
Thanks very much indeed, Mumuni. And I mean, it's very, very important that you are focusing on ways to get better outcomes for the investment. This is truly relevant, and I think everybody is in that mindset. To Claudia, please, anything you've heard?
I think an interesting thread across the different presenters was the idea of, alternative nutrition financing and cost efficiency as well. And so I think if anything, the silver lining in our current financial crisis is is the need for us to look for alternative sources. And I think the Nutrition for Growth pledges at 27.4 billion really show, without USAID, really show that we have the capacity to raise the resources.
Yeah.
And, how can we keep knocking on new doors and different doors to try to tap into to new types of funding that can perhaps be more sustainable? I love the idea of the sin tax, the taxing on highly calorific drinks. I think we first saw it in New York 20 years ago, and but it hasn't taken off in developing countries, and why not? So I think the idea of alternative financing, but also creating efficiency through both the approach, as Mamuni has mentioned, but also efficiency by bundling and trying to do things catalytically so that you can leverage health resources for nutrition, or you can leverage early childhood development resources for nutrition. I think I did hear a lot of that through the panel, and it's really an interesting and promising approach.
Very good. Thank you very much indeed. Nancy, very short.
Thank you. One thing that I heard was some passion from Mamuni here to talk about treating young children with SAM. And that's something that we at FAO don't do. We don't work in the treatment of malnutrition, but we do look for ways that we can match our what we bring to the table, our work to support food and agriculture, repurposing of subsidies, trade policies, these types of things, with the work that's being done on the ground with someone with so much passion like Mamuni. And I really appreciate that, because it shows the vast network possibilities for us working together, because there's so much we can do in nutrition. And I look forward to the opportunity in the networking event to hear more about what others in the audience are doing in the field of nutrition, or what they might be interested in doing.
It is a vast network. Thank you, Nancy, for your leadership. Across to Lena, please.
Yeah, thank you. I think we're all very much aligned, because I also wanted to say what I noticed is, like, for example, as we say now in the Philippines, and Mumuni, you both talked about fiscal policies and SSB taxation. It is happening, and it is part of the WHO package. Fiscal policies, front of pack labeling, reformulation, you name it. We have the package, and it's based on evidence. What we do need to address is fight, I would say, the fake information about it and the scare for governments that, oh, it will influence and we will lose money, the economy will be affected, there will be unemployment. There's many tactics, and we need to speak about it, and we need to address that. And to speak about it is we need to rebalance the power for that. And I hope that more and more will be talked about. For example, also in the UN Food Systems Summit stock-taking moment that is coming up, we definitely need to address those power imbalances, because there's money that we can redirect, as we all noticed and said, and it can really work. One last thing is that for that, we should also involve the parliamentarians, because they need the right information and not be lobbied by some powerful actors.
Thanks very much, Lena. There you go. Everybody, we've got a few minutes, and I hope that some of you are sitting very much saying, I want to contribute. Come and be part of the discussion. Let me just get a rough idea of who would like to say a word or two now. Could you just raise a hand? I just want to count the number of hands. Okay, so we've got about 12 hands up, and there'll be more that come. So what this means is we'll have a microphone or two, and we'll ask you to pass the microphone, don't throw it, to the person closest to you who puts their hand up. Could you say your name and make your point? But if you go on long, I have to ask you to shorten it. Please come in, ma'am. Yeah.
Okay, I'll go first. Hi, everyone. I'm Liz from World Vision. I appreciate all of the comments about the affordability of healthy diets and the potential of taxation. I just want to really resonate with what Lena was saying about food profits and food billionaires. And I would like to pose to you all the question of how we can garner the political will necessary to take meaningful action to lower the price of healthy foods without only focusing on increasing the unaffordability of unhealthy foods, because we need to meaningfully take action on both sides. We cannot only increase the unaffordability of unhealthy foods.
There you
This
go.
will have
Get the cost down.
Yes,
Thank
thank
you.
you.
Thank you. Thank you. Pass. Whoever's got their hand up close, reach forward and grab the microphone. Ma'am.
Hi, my name is Claudia. I work for the WHO Center of Environment and Health. We're developing a strategy on food systems as well. And I have a question for Nancy. In your presentation, you highlighted that the policy stays within WTO rules to support nutrition objectives, which is really encouraging. But in many discussions, there's also a concern that trade liberalization has contributed to unhealthy dietary shifts. We see that through increased availability of ultra-processed foods, reduced policy space for domestic food system protection, or corporate influence. So I was really keen to get your perspective in what ways do current trade rules pose tensions with mission goals, and how can these be better reconciled to ensure trade becomes a more consistent enabler of healthy and sustainable diets?
Thank you very much indeed for picking on that. Who else has got their hand up? Okay, if we could get the microphone to come up the middle. Is there somebody got a microphone? Yes, Christine.
Hi, Christine Campo Care. I was recently in Argentina. I love front of package labeling and the idea, and it's been in place since 2022 there. So I was snapping photos, and managers are like, why are you snapping photos of our products? Anyway, I was in love with it. But then when I asked people on the street, so how has this changed your diet? The importance of awareness raising, because people are saying, oh, but I'm not going to eat that entire thing of olives, or I'm not going to. So I think awareness raising of the impact and why those labels are there, especially to kids, I think is going to be key. So good luck.
Thank you very much indeed. If Christine's microphone could stay up, this side of the room, right side, keep your hands up. Okay. Yep, sure.
Thank you. What struck me in this discussion is some topics of what's coming next, and that were absent a bit of the discussion. The colleague talked about the ultra-processed food. Very often, the ultra-processed food is related to pesticides. Some are forever chemicals. Some are endocrinal disruptors. Ultra-processed food is in plastic, which is another crisis. So I would like to hear your reflections about this link, because it's growing in many countries. We know it's maybe the next health crisis to come. Thank you.
Thank you. What's your name, please?
My name is Alexandra.
Alexander, just for ease of saying who asked the question. Next question or comment.
My name is Jeffrey Blount. I'm a pediatric neurosurgeon who came to this through an interest specifically in spina bifida, because we have a front row seat to that suffering. And so the question that I want to pose, we formed an organization called GABSPIF, which is focused on micronutrient fortification. I'll give a very quick shout out to what I think is promising side event this evening. Those interested who are interested in micronutrients, there's a good side event talking about that. But specifically, I want to ask about synergy, because GABSPIF was formed on the notion that neurosurgeons have a front row view, and when we partner with good people like GAIN and FFI, and then continue to partner with groups like the Rotary, we synergize. And what my concern is that those of us that are interested in micronutrients, I'm not so sure we're properly synergizing with the greater nutrition community, and we don't want to be seen as a distraction. We want to grow the tent, grow the house, not be seen as a distracting counterforce to it. And so we're always open to influences on how we can continue to synergize. Thank you.
That is an amazing input from Jeffrey, saying we want to do it, but we want to do it right. Help us. And they're a really cool group. Thank you, Jeffrey, very much indeed. Who's coming next? Yes, ma'am.
Hi, thank you. Thank you for all the comments. My name is Elena Lattes from Columbia University and the International Initiative for Pediatrics and Nutrition. One thing, I mean, so many things to address and you know, in this committee, but one thing that's not being addressed that I don't hear a lot about is treatment failure. And how are we addressing the workforce and the clinical capacity to address treatment failure? Because I know we talked about, you know, preventing stunting by monitoring growth velocity. You need clinicians who know how to do that. And not that it's difficult, but it's not routinely trained or taught in many, you know, hospitals and LMICs. And I think there's a whole component of children and adolescents that have NCDs, that are seeing doctors. They have no nutrition support at all. And, we can tax, we can do all this stuff, but they still need that frontline care.
Thank you, Elena. And I think you were talking pretty much about obesity mostly, or were you talking about all forms?
I think about chronic disease. You can, apply to children with cancer, children with renal disease. I think many aspects of it.
Thank you so much. Thank you for coming and talking about that. Next comment or question? Yeah.
Hi, my name is Elena as well. I am here from Foot Impact, which is a small nonprofit based in Nigeria. One of our cause areas is nutrition. It's obviously a huge problem there. And my question kind of goes back to the idea that so many billionaires, so many food billionaires kind of sprouted up during COVID. And we're looking for innovative financing, for ways to mobilize resources into the nutrition space. What is the role of corporate social responsibility in that? How do we engage private sector, and how do we kind of couple that with trying to minimize the number of people that are making so much money off of obesity and bad nutrition?
Thank you, Elena. Very important point. Who else would like to make a comment? We can take a few more. There's a lady here, tentative. Yeah, thank you.
Good afternoon. My name is Uyam, and I work with International Organization for Migration. I would really love to. I came here for also keen to know more about what's happening and the news about new way of thinking or addressing malnutrition. And I would really want to hear further reflections when it comes to the migration, climate change, disaster, risk reduction, and how these interact, like intersecting, especially in conflicts, and then how to cover the migration dimension in these cases. Thank you so much.
Thank you very much indeed. Thanks for coming and joining us and actually standing up and speaking. Anybody else? Yes, gentleman very next to the microphone.
Hi there, Charlie with Consumers International. We represent consumer groups.
It's Consumers International.
Over 100
yes.
countries. Really interesting to hear everyone's comments. I think there's been a lot of focus on shaping some of these solutions and all the evidence we have on solutions. I'd love to explore a bit more. We're thinking a lot about how do we engage countries that are not able to act for whatever reason, maybe not recognizing what these solutions are, or what are the barriers to actually acting, and start sharing that evidence to explore what are those issues and how can we. We're thinking about how to create demand from consumer groups, from consumers and communities, but we'd love to think about how to work with others as well to achieve that.
Thank you very much. Charlie has taught me about the power of consumers being able to put pressure on those from whom they purchase what they're consuming. Thank you, Charlie. Lady in the back, thank you.
Hello, I'm Nicole with Médecins du Monde Switzerland. My question goes down to the general articulation that might exist or not, or I would be interested to have your insight about how you work with experts that work on social determinants of health that, as you might know, are very, very closely interlinked, and they were mentioned several times. All these fights around equity, rights, people that become richer and richer while others remain in poverty. The very direct link between nutrition, action, intervention, and those social determinants of health frameworks. Be interested to hear a bit about that.
Thank you, Nicole. So everybody in the panel, we've got quite a lot of comments and questions about the challenge of mobilizing finance, particularly given what Lena said about the number of food billionaires that emerged during the emergency phase of the COVID pandemic. Interesting question from Jeffrey saying how to get synergy between clinicians working for micronutrient fortification and the rest of the nutrition community. They want to be part of the process and not perhaps seen as a distraction. And Elena, a pediatrician, talked about how to deal with treatment failure and to get clinicians more understanding of the issues. We've had questions on the links between nutrition, migration, and climate change. questions about how to engage consumers more, and questions how to work more on social determinants of health. Christine asked about front of pack labeling and said, how can you raise awareness of its significance? And Nancy said, can you talk about trade rules and nutrition? There are some inconsistencies there, she felt. So you don't have to pick up every question, it won't work. Just take one or two that you feel like, I'm going to have to be a bit tight on time. Again, the same order. Azucena, what's struck you from these comments?
Okay, so I'll take on Jeff's concern about neurosurgeons being an ally, not a disruption. Well, actually, the Philippines, we are finalizing the policy on the adoption of the World Health Assembly resolution on fortifying wheat flour with folic acid and iron to prevent spina bifida and other neural tube defects. Because in the country, there are lots of spina bifida cases as well as neural tube defects.
Yeah.
So this is the reason why that I'm really, really onto that. And yes, we will be working with the medical team, like we have lots already coming in and then writing us, how can we be of help? So we're into that. And then second is on the hospital side, treating patients with cancers and other illnesses in the hospitals, that nutrition is always forgotten. Yeah. So we have a hospital pathway for nutrition. We have a book on that in the country, and we're into, not because we're only on the public health and nutrition, but also we're into hospital nutrition, and we are into that. We have the pathway, so we have the guidelines. So we're looking into that, and we would like to monitor those hospitals that taking care, because actually when you treat patients with cancers and other illnesses that are really long lingering, you will always prevent more spending when we look at their nutrition.
Yeah.
Okay, so I'll give the.
Oh, that was absolutely fabulous. And Jeffrey, I hope you're staying just a bit after the end, and we'll have a chance to talk to Azucena and her colleague who's sitting just here. They will be able to share lots of exciting stuff. Mumuni, please. Any reaction to what you've heard?
Yeah, I don't have many things to add, but I can say something about billionaires,
Yes,
how to
I was
have
about
more
to
money.
hear.
Yeah.
It's your success with
Yeah.
extracting from billionaires.
Yeah, what I can say is that we need more civil society engagement, don't let politicians and billionaires, rich people take decisions without us. I think we need to push them to take the good decisions in order to enhance nutrition for our populations. Yeah.
And Charlie, I hope if you're able to stay at the end, you will connect with Mumuni a little bit about how consumers and Consumer International have really picked up on this one, certainly since I've known you over the last few years. Thank you again. Mumuni?
And for the treatment of malnutrition, perhaps what I can say is to make a link between hospitals in rich countries and NGOs which are working in poor countries to work together in order to, I don't know, to better take care of malnutrition. This is what I can.
And do you do that in Alima?
Yes, for sure.
Thank you. Look forward to hearing more about that, Mumuni. Let's go to Claudia, please.
Thanks so much. A lot of really interesting questions and diverse questions. Perhaps just touching on Jeff's question around spina bifida, I think there's a really interesting opportunity. There's a new infusion of cash and interest around multiple micronutrient supplements. And I think with that comes strengthening of nutrition systems in health. especially both preconceptual health, obviously through adolescent girls, micronutrient supplementation, but also, in antenatal care. And so I do think that there's an opportunity here. The food fortification folks, I tend to find they're a little bit siloed, but certainly the multiple micronutrient folks are directly integrated into health systems. On the treatment failure question, I found that quite interesting because one of the challenges we've had is that undernutrition, if you're not severely wasted, undernutrition is actually very invisible. And how do you make it more visible? So if a child has a short stature, if every other child has short stature, you just feel pretty normal, right? Or you feel pretty normal if you're tired at the end of the day because everybody's anemic. Like I work in areas where 60, 70% of women are anemic. It's just normalized. So how do we make it less normal? And we make it more visible by putting the responsibility in the hands of parents. For example, my colleague here spoke about the family MUAC. Can we empower parents to monitor their children so that they know when they're malnourished? That we can get more visibility around malnutrition. When I go to see my family doctor, and if she doesn't actually do my BMI, I call her out on it. I'm an advocate. I say, you should be counseling me, right? So how can we be advocates with family practitioners and others? I think the other opportunity is through pre-service training for healthcare workers. So through schools of nursing and midwifery and through medical colleges, can we actually influence the curriculum so that we are including nutrition in the curriculum and making it a little bit more sexy, right? Because a lot of medical students, they only want to talk about surgery. They don't want to talk about nutrition. So how do we make it a little more sexy? How do we include it in the pre-service curriculum and not just in the in-service curriculum? The one around social determinants of health, I think if we are naturally going to be integrating nutrition across systems, we have to integrate nutrition, because nutrition is part of many different sectors and we need cost efficiency and we need reach. So it has to be integrated. So if I think about the social determinants of health, specifically things like gender, taking the equity lens, keeping girls in school, these are all really important social determinants of health. And in AKDM, we think about them synonymously with nutrition impact. And so I think it's a case of thinking about that particular cohort, like adolescent girls. You have to think about them holistically and touch all social determinants in health in order to have an impact on, say, their nutritional status, should they choose to have children. So thinking about it holistically and focusing on a broad range of social determinants of health, for me, isn't an option. It's absolutely crucial for effective programming. I'm going to pass over to my colleague from FBO.
Before you do, can I just ask you one question? You're very comfortable using the word nutrition, but I find that quite a lot of young medical students and junior doctors don't really tune into that word. It doesn't make them dance all night. But I do think nourishing is something we could play with, because we nourish our souls, we nourish our hearts, we nourish ourselves. And so I've taken to encouraging people to talk more about nourishment as what's necessary for the human or animal or plant beings, rather than nutrition, which is more a term for a discipline. Do you have a view, Claudia?
I mean, I think we need to integrate it into curriculums early on and get people excited about it, because when we talk about nutrition from all of the different aspects and how it touches our lives, I think it's absolutely crucial to good health. But it's not as tangible, right? It's not as tangible as having, a good surgical outcome or curing a case of pneumonia. It's not as tangible because you see the results over longer periods of time. I think the climate impact piece could change that, because obviously, as we're seeing more heat stress in pregnant women, we're seeing more preterm births, more stillbirths, more small for gestational age babies. And therefore, we're having to think about the newborn intensive care units and the community newborn care and other aspects that become a little bit, perhaps a little bit more interesting to healthcare workers, those nutritional aspects. But I do think it's a challenge, but I think we have to start early in the journey of careers for healthcare workers and put it in the pre-service curriculum.
Thank you. I'm just going to be a bit mean and go to Mumuni and Azucena just for a second before we go to our experts. Mumuni first. Are you okay with the way the language we're using about nutrition at the moment? Do you find it excites and inspires the new people who are joining Alima?
Good question. I don't know. I think it's a question for for people here.
Yeah.
For us, it's okay as we are working every day on nutrition. You know.
Yeah. Well, let's keep hold of that. That we might need. We've got some experts coming up soon, like Francesco Branca and Dan Irvin. Perhaps we could push them a bit on the narrative. Let's come to Azucena. I mean, you've been talking to presidents. You've been doing all sorts of really wonderful stuff.
Actually, he understood well nutrition. He understands nutrition. But actually, my personal experience, David, and the rest, I have 4 daughters, and my 2 daughters are both lawyers. But they're now keen on, oh, Mom, I want to hear more about nutrition.
No.
Yes, so that's it. No, so in the Philippines also we have the youth. We have very, very active youth participation, and they're really keen on nutrition. But one thing for sure, David, I'm with you with this, because the PPAN, the Philippine Plan of Action for Nutrition, the N acronym. All right, so thank you.
Nancy, nourished Nancy.
So I think it's an interesting question, and I think that it's knowing your audience and knowing who you're speaking to. Within the FAO, we've been working a lot on healthy diets, and that resonates with colleagues across the different disciplines and subdisciplines of the agriculture sector and subsectors, more than talking about nutrition, which within my agriculture community felt a bit outside of our realm of work. So we talk about healthy diets, and that's something that resonates more within the work that I do. But then I do see that in other circles, it's talking about nutrition that helps. So it's really about listening to those around you and being able to engage with them and meet them where they are.
But I have to say, as somebody who travels quite often to FAO, there is a bit of a stronger buzz about nutrition now than there was 10, 15 years ago.
Thank you.
That's because of her.
Thank you, Nancy. Let's go to Lena.
Yeah, thank you. I want to respond to Liz from World Vision. She was saying like the prices of healthy foods to come down. I mean, that's the challenge, but it can work if we connect the systems and we take a systems approach. If we can have taxation of the unhealthy food stuff, there should be negotiation within the government and leadership so that the profits for that, and not only the taxation of SSBs, of sugary drinks, but also tobacco, that it can be invested back again into subsidizing social programs and have the reduction of the prices. And it's done in some countries, so it can work. The second point was on ultra processed foods.
Yeah.
What's next? Well, WHO is taking that on, and we are with experts going to give a definition, because there's not yet a globally accepted definition of ultra processed food. So that's what we are going to take on, and provide also guidance on how much under different circumstances and for different groups we can eat ultra processed food. So we're taking it on, and we are counting on your support to make that known, because of course that is something that is very, very challenging.
And I mean, that's when WHO really is needed When an issue is difficult, when the definition is unclear, when the long-term impact has not yet been worked out, that's when the world really needs its World Health Organization. It connects together professionals from all over the world, so they become part of an interconnected web. And it's that web that will tackle, amongst other things, ultra-processed food. It's really important for the future of humanity. Thank you, Lena, for bringing that up. Kudos to Francesco Branca sitting in the front row, who's never shied away from anything, certainly not this. And that's, in a way, mostly what we've heard from our panel. And I think I'm going to say to the panelists, you have been remarkable, you've been responsive, you've been humorous, but most importantly, you've helped us to see a way forward in this quite tricky area. And I think I'd like everybody to give them the biggest possible clap we can. It's been a good panel. And with that, we let our panelists gently make their way back to the body of the auditorium. Thank you again, everybody. Super, super panel. And I'd now like to invite Dan Irvin, who is the Global Director, Health and Nutrition of World Vision International, to come up here, and he can come where I am, or he can stand in the middle here, I'm not fussed where, and just give us basically 5 minutes of your reflections on what you've heard. Dan.
Thank you, David. Greetings, colleagues. Wonderful to be with you all today. Thank you for coming en masse. It's fantastic. I'd like to say first, it's a great privilege to have this assignment to try to summarize as eloquently as possible the brilliance of all of the people who have been speaking here. And I would like to thank Valerie and David, as well as all of the panel, for their contributions. I think this task of summarizing this much amazing content makes me the World Health Assembly Poet Laureate. And I would like henceforth to be referred to that way, if you would. We heard, firstly, in the beginning, a bit of the history of what is bringing us here to this moment. We had the amazing conventions years back of the UN Decade of Action on Nutrition. We had the World Health Assembly nutrition targets noted. But then in recent years, and we were very inspired by those conventions and determined, but in recent years, we've been struggling globally a bit. We were hit by the pandemic. We were hit by economic recessions. We have increasing inequalities that are beguiling us. We heard from Afshan that today there is, because of aid cuts, current aid cuts, an increasing number of children who are unable to access normative health services. And unfortunately, she mentioned a 60% mortality marker associated with those children who are not accessing services. So we have a growing child survival crisis. Afshan then went on to talk about the inspiration of the Nutrition for Growth Summit, and I'd like to paraphrase her comments a bit because I think they're also very important for our setting. Firstly, there was the emergence of new and exciting commitment makers at that forum, private sector, philanthropies, development banks, and a new leverage that they are bringing to our nutrition finance equation. Secondly, a much larger, expanding picture of levers. I say levers, that's my dialect. Afshan said levers. I quite like levers, but I'm being true to my origins. More sectors engaging, more solutions, more opportunities were highlighted there. It was very exciting. An expanding nutrition narrative, what she referred to as a golden thread, making connections from the health ramifications of nutrition to the economic imperatives, and also speaking in a more colorful way, if you will, about the transformational power of nutrition and the importance of nutrition as a human right as some of you in the audience also later noted. She spoke about the focus on public policies and a broadening range of policies that are coming to bear. And of course, the multi-sectoralism of nutrition and the fantastic opportunity to bring so many new stakeholders into the nutrition discussion globally, not only to talk to them about how nutrition is important to their outcomes, but how their investments impact nutrition outcomes in return. A win-win paradigm. We heard then from the panel about many challenges, of course, and I'll just reiterate a few quickly for context. I noted the challenges in terms of, first, some of the common issues. We heard about the triple burden of nutrition. We heard about obesity. We heard about breakdowns in nutrition commodity pipelines at the front line where they're needed most. We heard about the 2.4 billion people in the world who can't afford a healthy diet. We heard about challenges of fake information, food inflation, ultra-processed foods. Then we heard a little bit about contexts, the contexts of human or man-made disasters, natural disasters. We heard about the prevalence of acute malnutrition and that we're only reaching about not more than half of the children who are experiencing acute malnutrition. We heard about the $10 trillion cost burden on health systems associated with malnutrition. And then we heard about the response, issues, challenges with our nutrition response within these contexts. For example, I mentioned the treatment gap in severe acute malnutrition. There was mention of, I think this was Lena, talking about needing to develop a wind or a hurricane of nutrition finance and investment moving forward. We need to enable the health workforce with nutrition competence to be able to deliver nutrition interventions at multiple levels of the health system. We heard about the need to address the social determinants of health and nutrition outcomes. So quite a lot in the challenges area, but happily, quite happily for me, we heard much more about solutions. And so I'd just like to characterize many of the solutions that we heard. Some of them were in the realm of governance, the very large theme that we've seen here around the need to take integrated approaches, layering different sectoral interventions, the importance of bundling of services to gain efficiencies. Also, the great examples of regulatory work in governments and taxation, labeling, innovative financing, so important for us. Data system strengthening, health system strengthening, and then also within the multi-sectoral examples that we heard about the importance of youth engagement and the outsized role that youth will inevitably play moving forward, which gives us great inspiration and hope. Afshan mentioned something very interesting about harnessing NGO competencies, something that we don't always coordinate adequately. More work in social protection, work in food fortification, in WASH. Very interesting comment from the audience about leveraging consumers and a consumer perspective, working on nutrition more clinically in hospital settings, and David's focusing on nourishment. In nutrition itself, we need to do far better in working along the continuum of malnutrition on the front end with a focus on prevention and early detection and diagnosis. We heard of the examples of employing MUAC, of scaling up growth monitoring and promotion, of implementing the simplified approaches for addressing severe acute malnutrition, moderate acute malnutrition. I see you, David. No problem.
I'm just
Let me
leaning
just
on
say,
his shoulder, you know, friendly guy.
let me just say there were also the interesting comments on empowering parents and again, building health worker competence. I don't want to leave you without just highlighting a couple points of celebration that were raised. Thank you, Azucena, for telling us about the Philippines President Declaration on focus on the first 1,000 days. Thank you, Mumuni, for telling us about treating 350,000 children recently and 9 million in 2023. Thank you to Aga Khan Foundation for the large contribution declared at N4G. And thank you to our colleagues at the World Health Organization and the member states for putting the work in, along with the governments of Ireland and Ethiopia, to resolve to extend the WHO nutrition targets.
Thank you very much, Dan. You are a hero. Thank you, Pat. Just to say that
between them, Save the Children and World Vision made the most extraordinary commitment at Nutrition for Growth. I understand that it was about 1/10 of the total commitment bundle that was agreed. Quite extraordinary. Thank you, Dan, for your leadership. And my message, converge for impact. Put nutrition in everything. Thank you very much, everybody.
Thank you, David, for this panel discussion and your facilitation. Thank you, Dan, for the wrap-up of what have been said until now. So now we would like to move on the famous call of action, what we call the Geneva Nutrition Initiative. And we would like to explore a bit the potential and the relevance of this initiative. And for that, I'm very pleased to welcome Francesco Branca on the stage. You, of course, all know Francesco. Today, he is an invited professor at Geneva University. But you know him because from 2005 to 2024, meaning last December, he was in WHO having high positions, and especially he was a director of the Department of Nutrition and Food Safety. I would like him to give us a bit of background about this initiative and what can be seen in the future. Francesco, you have the floor.
Good afternoon to all, and thank you very much, Valerie. I'm so pleased that I found such a beautiful new home here, and a wonderful family that is welcoming this idea. And I'm particularly happy that Valerie has given me this task to work on two words which I love. One is action, and the other one is nutrition. We have a decade of action on nutrition, so what best opportunity to bring those two words together? Nutrition, as you all know, is a source of a lot of emotions. We can celebrate successes, and we are still having such enormous challenges ahead of us. You heard Dan talking about the growing child survival crisis, just at the time when we were celebrating a success in the reduction of child mortality. But again, it's coming back. And this morning I was hearing about obesity, and Spain was celebrating a reduction of -2%. It seems small, but it's important in childhood because it's actually turning the tide, reduction in obesity rates. But at the same time, the dire perspective of going from the current 1 billion to 2.3 billion people obese in 2050. So, nutrition has to be the place where we take that action. Where do we take action? And of course, it has to be people-centered. So the action has to be where the problem is. The action has to be in the centers where children are presented with malnutrition. The action has to be in the primary health care offices where doctors find people with obesity. The action has to be where people are suffering from lack of food. Indeed. And that's, of course, the responsibility of people providing services and people who are making decisions about those services. But we also know that there are decisions which are taken in places where those people who are suffering the consequences do not have access. A lot of decisions are taken in places like Geneva, where governments or other actors convene and make those decisions. So I think I really would like to stress a point that also Dan made in his summary, and that's, and of course Afshan made in the first place, the centrality of public policies. So we need to believe in the importance of public policies, and we need to act where public policy decisions are made. Geneva is a very important international hub for that purpose. And let me give you 7 examples of why this is important. Health. We are having this week the World Health Assembly, discussions around the targets. The targets, had their influence on the nutrition agenda. Policy discussions around obesity, anemia, food safety, the development of strategies, and actually influencing the decision taken at country level. And in addition, we also have big actors in health, like the Global Fund of Gavi. Labor policies, Geneva is the place where the International Labor Conference is held, and discussion like maternity protection or workplace nutrition are taking place in those venues. We heard about trade. Nancy mentioned trade, absolutely important. Very difficult to penetrate the discussion at the WTO ministerial conferences. But as we all know, trade agreements have a major impact on nutrition. And there are policy options which can improve nutrition, being compatible with those broad policy directions the WTO is making. Human rights, of course, the Human Rights Council, and you know that we have a right to food special envoy, but we also have one on water, we have one on health, and important discussions on children's rights. I do remember important discussion, for example, on marketing to children being held here at the Human Rights Council. Migration, we heard migration, the Council of the International Organization of Migration. Refugees, we have the Executive Committee of the High Commissioner, and next door, climate change, where the Secretariat of the Intergovernmental Panel of Climate Change is being hosted by the World Meteorological Organization. So these are the venues. But we have the energy. Already Afshan and Dan mentioned the energy of civil society. The international NGOs we have here is remarkable, exactly in all those areas I mentioned a minute ago. But civil society is also the parliamentarians. Don't forget, we host here in Geneva the Interparliamentarian Union, where actually many parliamentarians who are visionary come here, and we've seen how they can cross-fertilize in their discussion. The energy of academia. This institute, the Graduate Institute, just to name some. Now, dialogues, importance of dialogues. I don't have to convince you about the importance of dialogues, but I just would like to acknowledge that, at least 2 organizations in this room have convened very important dialogues. I was really impressed by what World Vision and 4SD have done, convening 10,000 people in 54 countries, particularly a lot of young people, and bringing the conclusion of those dialogues to the Nutrition for Growth. So it's not just for the sake of being together. It's not just sterile talking shops. It's actually targeted meetings to have targeted advocacy for policy, building political agendas, being proactive on those political agendas and not reactive, but also being conveners here in Geneva of global discussions. We're not starting from scratch. As the saying goes, you stand on the shoulders of giants, and we did have a lot of good actions and dialogues already convened by WHO, FAO, SAN, Forest. I really enjoyed the debate that was hosted by the SAN and Forest last December, for example. So the structure for the dialogue is there. We have, a similar twin, I would say, a system in Rome. Next week, there will be a Rome Nutrition Week. That's another important venue. So can we do something here? And I think the purpose of this brief session now, and I'll hand over back to Valerie, is to hear from you, to hear what do you think about this? I mean, I think I've tried to give you the why. Now we have to discuss the what and the how. So in concrete, how would you do it? And we've been thinking in the past, and if we want to do it now seriously, we must move to the next step, and build on what particularly SAN, I must say, has been doing it and doing it together for a purpose. So Valerie, back to you.
Thank you. Yeah. So we have prepared a few testimonies to get a bit your feedback. And we have asked two questions to those peoples. What interest should your organization have in the Geneva-based nutrition initiative? And do you see Geneva as the right place to host such a platform? And maybe we can start with Jessica. Maybe we can start with Michaela Serafini, she's the president of Médecins Sans Frontières. She's on the back of the room, Jessica. And she would like to say the few words on the MSF point of view.
Hello, everyone. Sorry, I make you go around, but maybe that wakes a little bit the spirit. Yes, I'm the president of Médecins Sans Frontières Switzerland, and I would like to give some words. The idea of having this Geneva-based initiative on nutrition is something that we support, and we support it because we see once and again, whether in South Sudan, whether in Yemen, how nutrition is put late in that comprehensive approach that we want to give to patients. And that is how wounded don't heal. That is how HIV and TB treatments don't manage to be effective. That is how our diabetics or our hypertension people are having a nutrition that is not adapted to what we tell them they should. That is how pregnant women and children fall through the cracks when we propose a treatment that doesn't take into account their nutritional status. Because we see it once and again, we do believe that we need to make sure that nutrition doesn't come as an add-on, but comes as something basic as the other package of treatments, and is incorporated as one priority into that specific treatment, and not necessarily later in their visit or later in their treatment. When it comes to the second question, why Geneva? Well, we know that global health happens here. We know the actors that are present here in Geneva. There is a humanitarian hub here. Donors and institutions are here. Policies, financing, and even supply chains are drafted, are fine-tuned, are shaped in here. So we do believe that all the elements for it are present. Now, in that case, what we offer as MSF is also to bring the field reality. I heard that policies need to be closer to the field. I have no doubt they should be closer to the field, and what we can give you is that taste of what does it mean the field needs, the field necessities, and obviously also that idea of the advocacy that we can bring in, and the ideas of flexible systems that are able to adapt to the needs that are specifically in that specific point and for that specific patient. So as MSF Switzerland, we do support this initiative, and we look forward to participating to it. Thank you.
Thank you, Michaela. Maybe, Jessica, you can give the mic to Yvette just in front of you, Jessica. Yvette Gonzalez is the medical director at Terre des Hommes in Lausanne.
Thank you very much. Thank you, Valeria, and thank you for organizing this event and for giving us the opportunity to participate. As most of you will know, Terre des Hommes is the biggest child rights organization here in Switzerland. This is Terre des Hommes Foundation that is based in Lausanne. We have different activities. Health is just one of the programs. We also work in migration, access to justice, protection, WASH, which is a great opportunity for us to work in an intersectorial approach, as was mentioned today. And when we talk about nutrition, is definitely the way we do it. We work together with our protection and WASH colleagues inside the organization. On health, we are focused on perinatal health and health of children below 5 years old. Even when Terre des Hommes is not a nutrition specialist, is not our main focus, nutrition is essential to what we do because it's part of the topics that we take care of when we accompany pregnant women and newborns and also children below 5 years old. I don't need to repeat what was said before during the panel, but as you know, this is really important when we talk about health of children below 5 years old. For us, it's really, that will be really an honor to be part of a coalition, if I can call it like that, of different organizations working on nutrition is something that we want to support. From Terre des Hommes' vision is also how we can bring new technologies and innovation to improve diagnosis and to improve treatment and to be more effective and cost-effective interventions, as was mentioned before. Why Geneva? I don't think I need to say more. I think Michaela already said that. I totally agree with her. So yeah, thank you very much again for the opportunity.
Thank you, Yvette. So after, I would like to give the floor to Mira Chidler, team lead at GAIN. Oh yes, she's there.
Yeah, we're all seated at the back, so make you turn your head around a bit. So yeah, so I'm here representing the Global Alliance for Improved Nutrition, and obviously nutrition is really important to us. It's in our name, and it's really at the core of everything that we do. GAIN works in food systems. We work to improve food systems to have better nutrition outcomes. And we're at a state where inadequate diets have become the leading factor in disease and premature mortality in every country on earth. Whether we're talking about NCDs or we're talking about undernutrition, it's really at the root is inadequate diets. So what interest does GAIN have? For GAIN, we really want to think about prevention. How do we improve food systems so that we have better diets so we can even prevent malnutrition from happening in the first place? I always think of nutrition a bit as a Venn diagram, where the three main areas are kind of like you've got your health, you've got your food, you've got agriculture. And what I'm really hearing here is there's a lot of other areas kind of that come into that Venn diagram as well. And I think, we think of Geneva as being, it's like the health hub, but there's also a lot of other things that happen in Geneva. And, the person who was here from IOM as well made me think of that. So I think it's also an opportunity to also help us break a little bit out of the nutrition community. I think like every sector, we have a tendency to talk to ourselves. And so I think this is an opportunity to bring those in that touch on nutrition, because nutrition touches on absolutely everything that we do. And it's an opportunity for us to reach out to the non-typical partners that we maybe wouldn't normally be talking to. I think one thing that I've observed since like the recent crises in our sector is that people have started talking to each other more. People want to partner up. We've talked a lot about how we need to be clever in how we work. People want to partner up. They want to collaborate. They want to think creatively. And I think, is Geneva the right place? I think we've covered a lot of that, yes. I'll add a little caveat though. Francesco talked about Geneva as a place for a convening role, but we have to make sure that it doesn't become a dictating role or a directing role. I think communities know their challenges and they know their solutions best. And I think our role here is to bring people together rather than to tell them what to do. And I think GAIN's very, very happy to contribute to that. And I look forward to seeing you all at the next meeting.
Is Alessandra Roversi in the room? Haven't seen her. Maybe not. So let's go directly to Bruno Lab. Bruno Lab is one of the members of our steering committee at Geneva Health Forum, and he would like to say the few words on the attitude of the Geneva Health Forum regarding this initiative.
Thank you, Valerie. Yeah, so I'm one of the steering committee member of the Geneva Health Forum. I'm sitting at the Geneva University Hospital. Geneva Health Forum has been created more than 20 years ago by the two founders, Geneva Hospital and the university, with the aim of having a platform which gives space, a neutral space for civil society, international organizations, policymakers, academia, on global health challenges, and trying to then set a place where dialogue is possible, connecting also with civil society groups and organizations operating in the global south. The initiative, the Geneva Health Forum, is supported by the two organizations I mentioned, Geneva and University Hospital, and Canton of Geneva, and as well the Swiss government. I think my message would be definitely that this platform is at your disposal. It's about creating the environment, favorable environment for having the nutrition being one of the team. We've been visiting a bit our strategy over the last years, and we are really trying to make this platform a year-long event, and nutrition is definitely, potentially, if there is enough partners behind, becoming one of the thematic. Thank you.
Thank you, Bruno. So if you would like to be part, here is the QR code to register. Feel free to do it. The QR code is here, but it will be also during the coffee break. That's it. And I would like to thank you for this afternoon. The Geneva Health Forum invite you for this coffee in the forum to follow our discussion and to start more networkings. You can imagine how I'm pleased as a nutritionist to have this discussion here and maybe to launch something as an initiative here. Thank you very much for that. I may be not very polite, but I will ask you to leave quite quickly the room. It will be a bonus for me regarding Benjamin to clean the room and adapt the room for the next panel. Thank you very much and have a nice coffee and evening.